starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to NUIPIC's webcast on PPE safe practices. My name is Mike Jennings. I am a senior program manager in NUIPIC's Wastewater division. I manage the Lowell-based operator training program. I will be leading this webinar. We have 87 people signed in so far of an anticipated 180 plus that have signed up. So we're going to give it another minute or two, and then we'll get started. Everybody is muted and in listen-only mode, so just stand by and we'll get started in a little bit. While we wait, I'm going to put my camera on and say hello to everybody. Welcome. This webcast right now, we had over 180 plus attendees sign up, and they're throughout New England and New York, which is great. This is an important topic, and I'm glad that everybody decided to join us. I'm joined in our behind-the-scenes role by Jennifer Lichtensteiger from NUIPIC, who's helping with logistics, and I'll give her a chance to turn her camera on and say hello. Hello.
Hi, everyone. Thanks for joining us.
So Jen's going to help run the Q&A behind the scenes and take care of any logistical issues. Is that correct, Jen? People signing in?
That's right. If you have any issues, send me a text in the text box, raise your hand, and I will work with you to try to resolve any IT issues that you're having with the webinar today.
So this webcast will have the latest info on COVID-19, PPE recommendations for wastewater operators and collection system staff, and will be a refresher on PPE for wastewater operators. There was some information that was out there ahead in the past, pre-COVID-19, so we'll do a refresher on that. We're ready to get started. So Jen, I'm going to shut my camera off, and you can as well. I'm not going to have this on while I'm talking, but we will be sharing the screen and marching forward. So why don't we get started? Okay, so PPE safe practices. We're using the GoToWebinar platform today, and you have a control panel. I think in this day and age, everybody is familiar to a degree now with online platforms for group training or large web group meetings. Everyone is muted right now. This is a webcast. It's not intended to be interactive web meeting. So we're going to just be presenting information. You do have a chat box there. Again, if you're having trouble getting into the webinar, you can chat, and Jen send it to the organizers, and Jen can help you if you're having issues logging in or with the broadcast itself. So that's a way to reach out to us if you're having technical difficulties. I'm having technical difficulties. All right, so here's today's agenda. One of the things that we want to talk about, we have a new look for NUIPIC. We went through a rebranding effort that we unveiled on April 22nd, so we're going to show a little bit of the new information relative to NUIPIC. I have some information on virus survivability in the environment. We'll look at some CDC and OSHA information. We'll talk about PPE considerations, and then we're going to share some information on NUIPIC's upcoming distance learning opportunities. We've had to rapidly shift our normal in-person training to a remote learning platform, and we'll unveil some of that information. I wanted to be clear up front that the information relative to COVID-19 is from the Water Resource Foundation webcast that was held on April 16th, titled Coronavirus Disease 2019 Latest Research Forum. There are slides from that presentation that can be obtained from the internet. What I've done is tried to make clear in my slides which of those slides are coming from speakers that participated in the Water Resource Foundation's webcast. And I also just want to emphasize that risk-based determinations based on what you should do at your facility are best made at the local level and in consultation with the experts. So we're presenting information, but we're certainly not going to give, we're not medical doctors or experts in infectious disease. We're just presenting information here today. So more about NUIPIC and our new presence. And I got a hair trigger here on my mouse. So NUIPIC, you probably noticed our new logo, and hopefully you like it. As I mentioned, on April 22nd, NUIPIC released a new logo and strategic plan as a result of a comprehensive, inclusive long-term process. Over the next several months, we'll be updating our materials to have this new look and feel universally. One change that we're making is, knowing that our name has numerous connotations and pronunciations, we are really emphasizing NUIPIC as the organization. I was given a note, NUIPIC rhymes with gluey stick. So when you're wondering how to say NUIPIC, it's just like we have it up here. Again, we're a regional commission that helps the states of the Northeast preserve and advance water quality. That's not new, but we're putting it forward in a new, going about it in a new way. There's 5 impact areas in the work that we do, and I think that this webinar is a manifestation of all of them. We make connections, we work to protect the environment, we train environmental professionals, we have education, and we engage with our stakeholders. So I think that this is a perfect example of that. Here's our mission, vision, and values, which have all been updated as part of this effort. And again, we are working in all of those areas as we continue to present information remotely. So again, I had mentioned that this information is from the WRF webcast that was held on April 16th. With this information, you can go find those slides, and I will add that there are handouts available for this course. If you look on that toolbar, there's a handouts tab, and from there you can download all of these slides and a couple of the documents that I'll be talking about through the course of this webinar. So we really wanted to put this information out there, but with this slide, again, you can find the original materials and dig a level or two deeper into the information that I'll be sharing. So in terms of the PPE safe practices, one of the things that we want to talk about is COVID-19, and just to make a distinction, that refers to the disease that you get. COVID-19 is what you get diagnosed with when you are admitted to the hospital with this infectious disease. SARS-CoV-2, 2019, novel coronavirus, and COVID-19 virus refer to the actual virus itself. So there's a little bit of distinction that needs to be made as we get into the further slides that talk about the survivability of the virus on surfaces. Nice segue. So Dr. Charles Gerber from the University of Arizona talked in the WRF webinar on the survival of coronavirus in water, wastewater, and air. And if you notice, okay, bear with me for a second. I stopped to actually read a chat. if you notice this bar up here, this is when I am taking material from one of the speakers that was part of the Water Research Foundation's webinar. I'm going to make note of that up here so that you know whose information we're referring to. My slides just froze up. I don't know if that's because there we go. So Dr. Gerber mentioned that human coronaviruses are not new and they're very common in the environment. The common cold is a version of the coronavirus. The SARS coronavirus that was an issue 10 or 15 years ago, and the Middle East respiratory syndrome are coronaviruses, and the SARS-CoV-2 is the current virus that we're dealing with. Dr. Gerber mentioned that the coronavirus is not what would necessarily be a very robust virus in an aquatic environment. This was some testing that was done related to not the 2019 coronavirus, but another coronavirus, 29229E, in room temperature water, and it compares the first two, the lower slides of the coronavirus, feline coronavirus, but it compares it to polio. Polio is the top line that goes out 20 to 25 days. And polio is a virus that is typically considered robust in water. So relative to that, coronavirus is not, it persists in water, but it's not as persistent as like a polio virus would be. Relative to survivability on surfaces, this is a study that they did out at the University of Arizona related to, it's not a coronavirus, but it's an MS2 bacteriophage, which is a virus. It's a non-human infection virus. And fomites is a fancy research word for inanimate objects. So this is the ability to pick up virus from inanimate objects on your fingers. And the blue is under a high humidity condition, and the red is under a low humidity condition. And you can see that the viruses will persist on surfaces, acrylic glass, Formica stainless steel for a number of days, or will transfer for very efficiently, whereas like on polyester, money, and cotton, that transfer efficiency is low. The analogy that was used is the easier a surface is to clean, the longer the virus will persist on it, or a virus will persist on it. And that's why part of the preventing the spread of disease is to wash doorknobs and push buttons and things like that frequently to prevent the transfer from one person to another. Relative to the human COVID-19 virus, it has been detected in feces of patients. There are some data points from China and others. We have the research has shown that they have not been able to culture live virus from this. They just detect that there is virus there. This is another informational slide on survivability: 2 or 3 days on plastic and stainless steel, 4 hours on copper, 24 hours on copper, on cardboard, 3 hours in aerosols. Copper and some of those other heavy metals have an antiviral effect to them. And you'll even start to see people are using or marketing copper kind of push keys that you can use to push buttons with and open doors, because the virus doesn't like the copper. As we know from heavy metals, copper is one of those pollutants that a lot of organisms don't like. And this is a key point. There is no evidence for transmission from feces or fomites presence of infectious virus in sewage. So there's numerous reports of the virus being detected in sewage, or DNA from viruses being detected in sewage, but they have, as of this research seminar, infectious virus, a culturable virus, is not something that there is a lot of information on. To keep in mind, there's still many uncertainties and more research needs to be needed on that. But that was the latest information out of that Water Research Foundation webinar. During that broadcast, there was a gentleman from CDC that presented some information as well. We'll go into a couple of those slides. The gentleman's name was Matthew Arduino. As you can see, I have him listed up in that blue band at the top. There's the CDC website if people want to get the CDC information directly. There's been a lot of talk about masks and the need to wear masks and why we do that. This is cloth face coverings, and that is to help slow the spread, obviously. The third bullet down, rather the fourth bullet down, these masks are not intended to protect the wearer, but to protect the environment from the wearer. As we talk, little bits of spit and particles and all that comes out of our mouth, and the masks are designed to keep that from being spread around and contaminating surfaces and potentially infecting other people. So again, there's a lot of talk about cloth face coverings, not to filter out the virus from the air we breathe in, but to prevent us from spreading the virus around should you be infected. And we'll talk a little bit more about that as we get into the PPE. But again, I'm providing the linkage there that came right out of Matthew's presentation if you want to get more information. Again, there's been a lot of information out there about COVID-19 shedding. That's when people that are infected release the virus into the environment. The predominant mechanism for that has been through the respiratory tract, through coughing and spitting and you know, unintentional things that come out of our mouth as we talk. There have been some tests where they have tested feces and things like that, and they've got PCR positivity. PCR, for those people that know it, is polymerase chain reaction, which is a DNA test. And they have been able to see the DNA and the RNA of the virus in this excreted material, but it's not live infectious virus that has been found yet. Now, there's not a lot of research going on in that, and that's definitely a research area. But the analogy that I've been thinking of with this, it's like finding a snake skin on a hike somewhere, and you take a DNA sample, or you take a sample of that snake skin and analyze it for snake DNA. You're going to come back with a positive indication that you in fact do have snake skin, but it doesn't tell you if you have live snakes in the neighborhood, or it doesn't tell you how many snakes you have in the neighborhood. So again, we're detecting pieces of the DNA, sort of what happens when we do microbial source tracking in the stormwater area, where they will take a sample of stormwater collection system effluent and try to determine if it's human sewage or raccoons or geese or whatnot. Again, it's detecting the presence of an organism, but it is not necessarily related to infectiousness or concentration. Although with some of the tests that are going on, they're getting multiple different variants of the PCR signal, and they can tell that their concentrations of infected people can potentially be higher in that community. This again is another slide from Matthew and CDC, and it's somewhat reassuring that, you know, they're unable to isolate the live SARS virus. Further studies need to be done, but again, if you look at that last bullet, initial results suggest that measures to contain virus spread should aim at droplets rather than formite, which is inanimate objects-based transmission. And all of this is the fecal-oral route that they talk about in terms of becoming infected. And to date, there has been no documentation of fecal to oral transmission, which is this slide. It is unknown. The risk is expected to be low based on data from previous outbreaks related to coronavirus. And again, there has been no confirmed fecal-oral transmission of COVID-19 to date, but we're not testing everything that we can to make sure that's happening because we are still in crisis reaction mode. So better to take precautions, right? These are some general web links that you can go to find information from CDC. And again, this information is in the handouts that you can all download. and go and find that information on your own. A lot of these documents are related to the healthcare setting. Healthcare professionals are a high percentage of those who do become infected with COVID-19, because obviously hospitals and healthcare facilities are where the sick people with the virus go. So these are very protective measures designed by the CDC to protect healthcare workers. And there are some analogies that can be made to wastewater operators and collection system personnel, but it is up to the reader to go and make that determination. A couple of other guidance documents from CDC. The first one is what you would do as a critical infrastructure worker if one of your staff came into contact with a suspected or confirmed COVID-19 patient, how you would monitor that person, whether you would allow them back to work, and under what circumstances. And then the second one is just a general CDC guidance on cleaning and disinfecting public spaces, workplaces, et cetera, as we potentially transition back into a more open scenario for working and our daily lives. OSHA also has some COVID-19 resources that are out there. Control and prevention measures are in the first one. Another one for preparing workplaces for COVID-19. And then OSHA standards and COVID-19 as well. Private industry, if you have staff that become infected with COVID-19 and are unable to work, that is an OSHA reportable circumstance in terms of accidents and health monitoring. And that information, again, is available on that website. As we look to PPE considerations by work task, I'm going to shift into some information that came again out of the Water Research Foundation's webcast. Marc Le Chevalier is the originator of this information. This is the stuff that we all would be most interested in, I would think. So one of the things we will point out is, knowledge of virus and wastewater is not new. We know about norovirus and hepatitis and rotavirus, enterovirus, all things that operators and collection system operators have been exposed to since we've started working in the field. There are a number of health studies that have shown that wastewater workers have an increased prevalence of antibodies to these diseases, and that would be as a result of exposure to low level of virus, where the body has mounted a defense against that virus. That's not new information. And we even have included questions in our licensing exams related to infectious disease and its transmission via wastewater. So a typical grade 1 licensing question would ask, which of the following infectious diseases is not transmitted via wastewater? The answer is the AIDS virus, but the inverse of that is that tetanus, tuberculosis, polio, etc. are detected in wastewater. So we should be taking PPE precautions as part of our day-to-day job, and should have been doing that for a long time. And we may be a little bit lax in doing that, but it's not new information. We just have a new, unique, and robust or virus that causes a very robust disease. So we want to take those precautions where we can. In a perfect world, we, in our work, would have done a hazard identification and a job safety analysis to think about what we can do to protect ourselves from this information, from these viruses. That starts with management's recognition and responsibility to operate a safe work environment. And then the next step would be to identify the hazards of the work, and then to implement job-specific PPE. As it relates to the job safety analysis, we need to look at what are the specific hazards, rank them, and then come up with control measures for how to minimize that risk. So we have administrative controls that we can put in place, such as only one person in a vehicle now at a time to maintain that social distancing. Engineering controls related to cleaning and other things that we can do to minimize potential exposure to virus. Required PPE that will protect us from exposure. Training that goes along with that. Training is very important because you can't just hand people a bunch of PPE and say, here you go, you're safe. Staff need to know what PPE is important for each task, how to put that on properly, and how to take that off properly. So there's a training element that goes with that. And required permits, that's kind of a confined space entry issue, but there are specific permits that can be utilized, and lockout tagout might be another one of those that might be thought of in that way. But again, method of identifying ways to control those hazards. It's not just PPE. There are many layers to that. So Mr. Lechevalier actually got some money from the National Science Foundation to do a study that was published online at the Wiley Online Library. It was also done through the Water Environment Federation, protecting wastewater workers from disease risks, personal protective equipment guidelines. And this was came out of a workshop that they did with 40 industry practitioners, where they all got together over a couple of days, and they really dug into different work elements of the job of operating a wastewater treatment plant and managing and operating and maintaining collection systems, and looked into what type of PPE those workers should have access to and be trained on. And there was a matrix in there that was developed by Job Task that was referenced in the Water Research Foundation's webinar, and I have included in these slides based on the webinar slides. You can, on your own, go to the Wiley Online Library and have access to these, the same information. Again, there's a fee required. I went and purchased the rights to access the document, but just be aware that it's not free. So I'm going to spin through some of this information. This information was published in 2019. I think this was a response to the awareness that COVID was out there in the environment, and they based a lot of their information. I'm going to transition. I think it's the next slide. They based it off work that OSHA did 10 years or so ago related to the Ebola virus. When Ebola was quite prevalent in Africa, there was a lot of work that was done in the US and throughout the world to begin to look at what precautions, especially healthcare workers, would want to take relative to PPE to avoid being exposed to Ebola, and a very deadly disease, obviously, a very contagious disease. So this spreadsheet, I believe, is also one of your handouts if you want to. Maybe it's not, but you have the web link there, and the format is very similar, where across the top are the different job functions, and then down the side are the different pieces of PPE that should be utilized. And again, this was a framework that was rolled into the work that Mr. Lechevalier did for relative to wastewater operations. As you look at the potential ways that you can be exposed to this the virus, there's a contact transfer situation where, again, you might encounter some virus on a work surface or around the facility. So PPE for that would be gloves and boots and coveralls. If there are splash hazards, You want the face shields and goggles. You want eye protection because that's a route of exposure. Where there could be whole body contact hazards, such as entering a live sewer, Tyvek suits are frequently used or have been frequently used and would continue to be used. If the work task was someplace with sharp surfaces or, where abrasion, cuts, and punctures might be an issue, we would want leather gloves of some sort. Leather gloves can be worn over the disposable nitrile gloves that we were using and protect our hands from cuts. Where there's a respiratory hazard, sprays, mists, dusts, aerosolization of the virus, you would want masks. There's a lot of questions about N95 respirators versus cloth masks. The N95 respirator, I saw a video the other day. There are special ones for the medical profession that don't have the exhalation valve on them, because if you were to use an N95 respirator that has an exhalation valve on it and you're sick and infected and you cough in that, all of the everything that comes out of your mouth in a cough inside an N95 respirator with an exhalation valve just blows right out the exhalation valve and all over whatever surface you might be encountering. So the medical N95 respirators are a level above the general N95 respirator that you used to be able to just buy in the hardware store. And the video that I saw was actually done by the fire department. And what they were saying is that if their EMS people come upon someone who is potentially sick wearing an N95 respirator that is not medical grade, has an exhalation valve, the first thing they're going to do is put a cloth mask on that person over the N95 mask. So those are all things to keep in mind in terms of what is the appropriate level of PPE. I'm going to stop right here. Jen, are you on the line?
Yes, I am.
Okay, I'm just seeing some questions and some chats lighting up. I just want to make sure there's nothing coming in that we need to address in the webinar.
We've had a couple questions that I'm trying to address. Just asking if the materials will be available after the webinar. They are. This slide presentation is available in the handouts. If you can go to that section and download it now. Otherwise, we can send it out to folks afterwards if you're having difficulty downloading it. There were some questions regarding the research itself, which I referred back to watching the full webinar and whether or not the research was published and peer-reviewed. And I think other than that, some people were having difficulty seeing and hearing, which may be a issue with your internet connection.
A local issue?
Correct.
Yeah.
I'm getting all of your slides and seeing them work through, so I'm suggesting that people switch to select the circle in audio for telephone in call in, and you may be able to hear better. And if you get a chance to download the handouts, you can follow along as Mike's going through them offline while you're listening.
Okay.
And I think that's most of them right now.
Okay. Excellent. I was nervous that I'd been talking for a half hour and nobody could hear me. So this is the first chart that is part of Mr. Lechevalier's work. This is for collection systems. And so the work tasks go down vertically. The type of PPE or the potential risk or the potential exposure route goes across the top. And again, if you recall, contact transfer, that was PPE, gloves, coveralls, general workwear, splash, eye, face, that's a face shield and safety goggles. Whole body contact is Tyvek suits. Abrasion, cut, puncture is leather gloves of some sort. And then the one I can't see because my thing's in the way, I think is respiratory. And that would be a mask of some sort. And then X is recommended, and C is conditional, depending on specific tasks. So you can see there's a number of I believe the task that would require the most PPE would be live sewer entry or live sewer pipe repair work, where there would be a lot of aerosolization and materials getting splashed around. Routine wastewater treatment plant operator activities. Again, this speaks for itself. And one thing to keep in mind as we look at these slides is there aren't a lot that necessarily look to respiratory protection, but we're all going to be wearing masks anyways. That's the standard that I think people are being asked to do these days. So you're wearing a cloth mask to begin with. So you've already gone a level above what these recommendations would be. It's in a more protective scenario, and is the best practice. Again, I do not believe we're going to be returning to work or working without masks on for the foreseeable future in some way or capacity. So we're already sort of a level up above what's listed on this matrix. Moving further down the list, these are maintenance tasks. Preliminary equipment, that's talking about cleaning bar screens and screenings handling and grit handling and things like that. Again, those are conditional, but we know that we're going to be wearing masks anyways, and we're a level of comfort higher than what's listed on here. UV disinfection is relatively not a lot of exposure risk there, I would say. Biosolids handling. Likewise, now this isn't applying biosolids to an agricultural field. We have some guidance on that that's coming in a minute or two. But again, it's mostly the eye protection to avoid that exposure route. And, we're going to be wearing masks for the foreseeable future. So we're already more protective than what this matrix would identify. There is some guidance that's out there that predates COVID-19. So this information from CDC, which is easily obtainable, is designed to protect wastewater workers from waterborne disease. And again, the presence of waterborne disease isn't something new. So this is just kind of a refresher on what best practices are out there relative to hygiene for wastewater operators and collection system staff. And I'm going to just spin through these one at a time. So relative to basic hygiene for workers, and a lot of this stuff mirrors what we've been told to do in the days of COVID-19. Wash hands with soap and water. Avoid touching face, mouth, eyes, nose, and open sores and cuts. After you handle human waste and sewage, wash your hands with soap and water before eating or drinking. Wash your hands with soap and water before using the bathroom. Before eating, remove soiled work clothes and eat in a designated area away from potentially contaminated materials from the sewage. Do not smoke or chew tobacco or chew gum while working with sewage. Keep open sores, cuts, and wounds covered with clean, dry bandage. Flush the eyes with safe water. Waterproof gloves to prevent cuts and contact with human waste and sewage. Wear rubber boots at the work site. Remove rubber boots and work clothes before leaving the work site. and clean contaminated clothing with a chlorine solution as a disinfection measure. Relative to personal protective equipment, the guidance is to, again, goggles to protect the eyes, protective face masks or splash-proof face shields, liquid repellent coveralls, waterproof gloves, and rubber boots. It's important that training, as I mentioned, is incorporated into this as well, because training, you can't just give somebody PPE and expect them to follow it. So anyone who handles human waste or sewage should receive training on disease prevention. Should include information on basic hygiene practices, use and disposal of personal protective equipment, proper handling of human waste and sewage. Workers must also be urged to promptly seek medical attention if displaying any signs or symptoms. And that now also includes a fever or cough and things like that, right? In the days of COVID, we're going to send somebody home if they start showing any of those symptoms. Vaccinations is another thing that has been a subject of discussion relative to wastewater operators for a long time. And there are recommended vaccinations for those who work in the field. And hopefully that's something that you've been made aware of and have learned what your facility's health and safety policies are relative to vaccinations. So I mentioned the NIOSH. I mentioned that there would be a biosolids guidance for those who work with Class B materials. This is a document that came out in 2002, it looks like, and it discusses basic hygiene for workers who handle biosolids. And these are all from the same source, so they all look the same, but it's just reiterating the obvious. Wash your hands thoroughly with soap and water. Avoid touching face, mouth, eyes, nose, genitalia, and open sores and cuts while working with biosolids. Wash your hands before you eat, drink, or smoke, and before and after using the bathroom. Eat in a designated area away from the materials. Do not smoke or chew tobacco or gum while working with biosolids. Use barriers, gloves and coveralls, eye protection, etc. Remove excess biosolids from foot gear. Keep wounds covered. Flush eyes. Change into clean work clothes on a daily basis and reserve foot gear for use at work site. Do not wear work clothes home or outside the work environment, and use gloves to prevent skin abrasions. So hopefully you all have dedicated work gear and shoes that stay at the facility, and you aren't wearing your work clothes home. Ideally, there would be a shower facility at your facility, at your location, so that you can shower before leaving, change out of your work clothes, shower, and change into a clothes to travel home in. And if you do have to, or if you are unable to change before leaving, you don't want to bring your work shoes into the house, and ideally you don't want to wear your clothes into the house if at all possible. So if you have an attached garage, you leave your shoes in the garage. If you as soon as you get in, you change in the basement or something. That's a high level of precaution, but in this day, it's probably not unwise. So those are things that hopefully you are all able to practice in terms of not bringing, or have been practicing all along, in terms of not bringing material you encounter at work home. And again, I've harped on it quite a bit relative to training, because training on hygiene is important. and may not be something that we regularly think about when we talk about our wastewater operator training or our safety training. That often is first aid and other things, but training on hygiene and the proper PPE for the job is important as well. Frequent and routine hand washing obviously can't be emphasized enough before eating and smoking. The proper use of PPE, how to remove contaminated PPE, use of available on-site showers, lockers, and laundry services, proper storage and cleaning, instructions that work clothes should not be worn home or outside the work environment, prohibition of eating, drinking, or smoking, and procedures from controlling exposure to chemical agents as well. So the training and the aspects of training is where we will wrap up the PPE part of this presentation, and it, I believe, is my segue to talk a little bit about NUIPIC's training strategy moving forward. If I switch this slide. NUIPIC's distance learning strategy, because we are having to do things a little bit different these days, aren't we? We can't all get together at your state's training location and have classes. So we are looking at rapidly ramping up our distance learning strategy. So I have a couple of slides just to close out on that. We will be utilizing an online software to deliver pre-scheduled live facilitated training in 3-hour blocks. So what we are going to do is come up with a schedule where, just like our in-person training, we will have classes scheduled at designated times that people that are interested can log into and participate, and the system will monitor their participation and verify that they were there and generate their certificate. What it is not is on-demand training. So it's not a training that you can log into whenever you want to, listen to a recorded webinar, and get the credits for taking that training. This will be live training just done over an online platform. So we'll still have our traditional instructors instructing to the class. We'll have the ability to answer questions. We will have the ability for group discussions and polls and quizzes and all kinds of things like that to confirm that people that signed up were there and participated for the full 3 hours. We will be pursuing training contact hour approval in all of our member states, which is New England and New York, some of which we've already obtained and some of which are a little bit, we have some paperwork to do to make sure that everything is approvable in terms of training contact hours. But what will happen is there will be a web link, a URL, where you will go and sign up, pay with a credit card. You will be issued your unique identifier that allows you to click in when the class goes on, and we'll know that Joe Smith showed up. And throughout the 3-hour session, there'll be different things that will come up along the way to make sure that you're paying attention and you're still there. You didn't turn your computer on and go upstairs or go make breakfast somewhere and then come back when it's done. So you have to be actively engaged, and the system monitors that. And then there will be some trigger requirements at the end to show that you were present the whole way through. When the class is over, it will generate a certificate unique to you that you can then print out and save, that shows that you participated in one of these 3-hour trainings. This is the tentative schedule that we have set up for May. It's ambitious. We have a couple of obstacles that we still need to overcome, but this is what we're looking to do, starting on the 14th and running through the 28th, and we're only really looking at this 1 month at a time. By the end of May, we'll have a June calendar set up that'll have topics that will increase in complexity. So we're starting with very introductory and basic classes, and then over time, the topics will become more advanced, and that is designed to that is designed to be tailored right now for people that are new to the wastewater treatment field that need to pass a licensing exam. So we are targeting people new to the field. That's why there's a lot of introductory classes here. And we're going to follow the format of our multi-day training classes that we already have for basic municipal wastewater treatment, basic industrial wastewater treatment, and then eventually we will get to our advanced municipal wastewater treatment and advanced industrial wastewater treatment classes, and also pick up our wastewater laboratory class and some other topics in addition to offer a variety of contact hours that are out there. So we are moving forward, creating it as we go, and with a little bit of patience, we'll be releasing information on these classes very soon, hopefully next week. That concludes the slides that I have. I know I had scheduled this class for 90 minutes. I wasn't sure how long the presentation itself would go. It looked like we kind of moved through. I hopefully didn't speed it up too much and people got some new information. Any further questions, Jen, that came along?
One question that just came up was, what will be the cost of the classes?
We anticipate that a 3-hour class would be $60 in that neighborhood. Traditional 6-hour training from NUIPIC is $135. So we're going to less than half for less than, if we're doing 3 contact hours instead of 6, we're going to go with roughly half the cost of that. And fortunately for those folks that work at facilities, there'll be some cost savings there because there'll be no travel involved. Staff will be there'll be less disruption in terms of running things at the plant because they won't be gone as long to attend training. So we're thinking there's some trade-offs in there, and we're sorting that out in terms of is that the appropriate cost, and does that cover our expenses to deliver the training as well.
We also have a question regarding having a new operator that would like to take the intro to wastewater. When will we be sending the information out regarding the classes?
We have intro to municipal wastewater scheduled for the 21st, the intro to industrial for the 19th. We are ironing out the last bugs in our system to make sure that we can accept payments and the system works as seamlessly as we anticipate it. I would think that information will go out next week, I hope, saying that these classes are eligible to be signed up for. We're going to put them on NUIPIC's online training calendar, and then you would go to the training calendar, find the class that you're looking for, click on the registration link. It will bring you into the portal where you put in your information relative to the particular class that you're interested in. And upon completing the registration process, you'll get a message and a calendar reminder for when the webinar is with your specific link to log in so that we know that it's you. So I'm very optimistic that next week we would make an announcement related to that. One of the things that we did do was collect everybody's information as you signed up for this class. So we have the ability to send out through Constant Contact a message to the group that participated in this training, letting you know that our online or our remote learning platform is open for business. And then you can share that information with others at your facility or others that you know might be interested.
I have a couple more questions. The slides are available in the download section, but if you are having difficulty downloading them, let me know and I can email them out afterwards. We had another question about the will there be wastewater operator exam preparation courses in the distance learning program?
I'm sorry, can you repeat that? Will they be what?
Will there be wastewater operator exam preparation courses in the distance learning program? And these are components of it?
Yeah, they're components of the exam prep classes. So I would say that they all have a part to play. And what we can do is put a guidance together of which or how the topics would all fit into, whether it be a basic or a municipal license or an industrial license, if you're a Massachusetts operator per se, where there are municipal and industrial licenses. But all of the materials are designed to be applicable to a wastewater exam.
We're also being asked if we'd be able to invoice, or is it just a credit card?
Presently, it's going to be credit card only because we're trying to make this as automated as possible, where we are working with limited office staff and limited availability to get to the office. So we have made an organizational decision for it just to be credit card at this time.
Also have a question of whether or not there are TCHs available for this training that we presented today.
We did not pursue training contact hours for this training.
That's the last question that I have in the question box. If anyone else has any questions, type them in now and we can answer them.
I meant to put this guy back on at this time, so thank you for joining us. Again, we can take another minute or two to entertain any questions that come in. If not, we will end this webinar a little bit early. I do encourage everybody to download the handouts while we have this open. We're still learning the nuances of this platform, so I'm not sure once we shut down this webcast if you will still have access to those documents, so I encourage you to grab them now. And like I said, we can stay on the line and entertain any questions that come in through the chat, or with 180 people, I don't think I'm just going to unmute everybody. We're gonna leave it and listen only for those folks. But you do have a questions function and a chat function to reach out to us in the time that we have.
And I do have a question. Will we receive the link for this? And I'm assuming that means the PDF.
I'm not sure what that means either. We're not anticipating posting a recording of this webinar, if that's what someone might be thinking about. We're still learning the nuances of the system and what it would take to do that. So it's a potential that in the future you would have access to this, but we would encourage you just to take the PDF of the slides at this time. And, my contact info is in there. If people have questions on specific slides or whatnot, they can get a hold of me.
And that was an additional question that was in here. Someone said they lost hearing some of the presentation and was wondering if the webinar was recorded.
We are recording it. What we do with it after it's recorded, we're gonna learn and see if we can get that up on the NUIPIC website. Would probably be very helpful.
And that was there was a follow-up that the question was referring to posting of the recording. So you've answered that. Let's see. I think that's the last question I can see. If we want to wait another minute and see if something else is posted.
Yeah. One of the things I would mention as well is when we close this webinar, everybody will receive a brief survey on it. Did you find it helpful? Was there new information? Are you interested in training, remote training from us, etc.? We would appreciate it if people would just take a moment once this webcast concludes to give us some information that will help us continue to build our remote training platform. We originally, and we're doing this in a very dynamic fashion, we had originally anticipated that we would offer our classes from 1 to 4. And we got some immediate feedback that a lot of the municipal staff end at 3 or 3:30, and if we go to 4 o'clock, then there's potential for overtime. We want to avoid that because that might impact the number of people that sign up for our training. So we've shifted to mornings. We know that we can't, unfortunately, please everybody in the time that we select, but we are trying to, find that sweet spot of where the right time is to do it. So that's why we picked 9 to noon. Hopefully that's amenable or palatable to everybody. So, the feedback is valued and acted upon as we receive it. So please do continue to send us information.
Yep.
Anything new come in, Jen?
No new questions. And I did post in the chat box during the presentation that link to the PDF for the chart that you had for PPE on there.
Okay.
So if people didn't find it in the download in the slides, you can cut and paste it out of there right now too.
And that is some somber reading as you read about the different work functions that you might encounter in a hospital faced with Ebola patients. So if there's going to be any sort of super conservative PPE practices, that chart has it. But that is certainly not the case that we have with the COVID-19 right now, and certainly not the case with wastewater operators and collection system staff. But that is more of a format guidance for how the Le Chevalier information came together.
Yeah, so no further questions?
All right. Well, I appreciate everybody joining us. By my number, we got up to around 150 or so. So I think that we did pretty well. It's my understanding when I shut this off and end the webcast for all that you will all receive the survey. Feel free to reach out to me with any comments you have that aren't captured by the survey. And we look forward to providing more information to our stakeholders as we move forward. So keep you 6 feet, wear your masks, wash your hands. And we look forward to when we can get everybody back together in a formal training environment and do what we're really good at, which is delivering in-person wastewater training. But we think that we've got a reasonable accommodation here that should go a long way to filling the gap for training of operators. So Jen, thank you very much for your help. I think this went very well.
Thanks everyone for your attention.
I'm going to sign us off.
Bye everyone.